दोस्तों, you're listening to Touch a Life Foundation Tal Radio। मैं हूँ आपकी दोस्त आरजे डॉली और आप सुन रहे हैं टैल एक्सपर्ट। दोस्तों, होम्योपैथी चिकित्सा की एक पद्धति है जिसका उपयोग 20 करोड़ से ज्यादा लोग एक्यूट और क्रॉनिक कंडीशन के इलाज में करते हैं। होम्योपैथी ना एक सिद्धांत है और वो उस सिद्धांत पर आधारित है कि उपचार व्यक्तिगत होना चाहिए और प्रत्येक व्यक्ति के विशिष्ट लक्षणों, फैमिली हिस्ट्री, बॉडी टाइप और उनकी जरूरतों के अनुसार होना चाहिए। अगर दो लोगों को एक ही बीमारी है तो वो होम्योपैथिक डॉक्टर से अलग अलग तरह का ट्रीटमेंट और निर्देश प्राप्त कर सकते हैं। हर बॉडी ट्रीटमेंट के प्रति कैसे रिस्पॉन्ड करती है, इस पर भी ये आधारित होता है। होम्योपैथी डॉक्टर मरीज से उनके स्ट्रेस, रिलेशनशिप स्टेटस और उनकी व्यक्तिगत विशेषताओं के बारे में डिटेल डिस्कशन करते हैं। उसके बाद ही वो इलाज शुरू करते हैं। होम्योपैथी का मूल उद्देश्य सिर्फ लक्षणों का इलाज कर बीमारी को दूर करना नहीं है। बिल्कुल, उनका जो मेन मकसद होता है वो इम्यून सिस्टम पर काम करके पॉजिटिव रिस्पॉन्स को बढ़ाना होता है और उनकी लाइफ में पॉजिटिविटी लाना होता है, व्यक्ति को स्वास्थ्य की राह पर ले जाना है। तो चलिए आज 200 साल पुरानी इस पद्धति के बारे में, होम्योपैथी ट्रीटमेंट के बारे में और भी डिटेल में बात करेंगे आज की हमारी टैल एक्सपर्ट से, डॉक्टर कुकरेजा ए कलानी, MD होम्योपैथी एंड फाउंडर ऑफ कैंट होम्योपैथी क्लिनिक। वेलकम अगेन मैम।
Hello everybody, I'm Dr. Kukreja A Kalani from Kent Homeopathy, and I'll be speaking today about chronic allergies in children and adults and how to work upon it holistically so as to raise the immunity and find perfect treatment so that it doesn't get into a adulthood phase.
हम जानना चाहते हैं कि एलर्जीज जो है ना, ये बहुत चली आ रही है काफी सालों से। सभी को, किसी को एक्यूट होती है, किसी को क्रॉनिक, पर एलर्जी सभी को होती है। जैसे मुझे है कर्ड से, आई एम श्योर आपको भी किसी न किसी चीज से होगी मैम, राइट?
Allergies are very.
इसके कॉजेस क्या है मैम?
Yes. So if we get to the real causes of, what are the causes of allergy, we really don't know. It is called as, it is a idiopathic causative factor, meaning we really don't know why allergies are there in the system. So we can relate it to a low immunity where the patient is not able to fight against it, so they suffer. So there are two major causes we can sum it up as. So one is the environmental factor. So if in case there are trigger factors in your surroundings, say suppose there is too much dust or the cleanliness problem is there in the house, so we have like the carpets or the bed sheets or the sofas, all these have dust mites, so the majorly that is the trigger factor. Then it is the pollen allergy, that is during the seasonal change when the pollens are there in the air, then they are known allergens. They produce a certain chemical which excites a sort of an allergy in the system which can continue for very long. Then there also could be like the pet allergy. So if you have pets at home, then there is like the fur of the animal, say the cat or a dog, so that can also cause the allergy problem in small children or adults. Then one important thing that we should always consider is the state of the walls, meaning the condition of the house. So if there are damp walls, then also it's like there is growth of fungus and there are spores in the air. So that is one of the major thing that always patients should understand, that the dampness will always maintain the allergy and not allow it to go. So these are the few things which can cause major allergies, and also certain medications are there which can trigger the allergies in children as well as in adults. So this is the environmental cause which we can relate to. Then one major important thing is that we have seen the hereditary link. So whenever you have your mother, father or someone in the family having a skin problem, or you can say a cold problem or allergic problem, then we have seen that it transmits to children and in infants as well. So many times we wonder, why do these small infants under the age of 3 suffer so much? So we can link this to the hereditary influences upon the system, because of which they fall sick without reason. So they don't eat that much wrong, or they are not exposed to the wrong environment, still they suffer from cold, cough, and so this is one important thing that we have noted, that the genetically अगर आपको माँ बाप को तकलीफ है और स्किन की एलर्जी है या कोल्ड की एलर्जी है, तो वो बच्चों में डेफिनेटली पाई जाती है. And these allergies, if they are treated in time, say under a good age group till they go to class 1, say under the age of 7 or 8, if we are able to treat them with holistic medicines and not give them too much of antibiotics or so, then definitely these allergies are completely treatable, and they don't get to the adulthood phase. So these are the two main things we can relate to. One is the environmental trigger causes, and second is the genetic inheritance, that is you're susceptible because of your weak immune system. So these are the major causes of allergy.
ओके डॉक्टर कलानी जी, जैसा कि आपने बताया कि ये जेनेटिक भी होती है, तो अगर पेरेंट्स को है तो आपको भी होगी. तो द मेन थिंग इज आपको उससे दूर ही रहना चाहिए. Am I right?
दूर इन द सेंस कि अगर उनके they are adapting to the surroundings, they are learning. It is a process of learning to adapt so that they can fight off the allergies by themselves, and over a period of time they themselves will come out of it. But sometimes what happens is the immunity is so low that we need to give some immunity booster medicines in homeopathy so that they go through it well. So they're going to fall sick once they go to they go to play school and all. They have to interact with children. You'll find different children coming, and there's not a very controlled atmosphere. So the AC is on, or the child, the other other children are suffering, so you're bound to get allergies. But how do you treat it is very important. If it is just a one-time allergy, then you take allopathy, we are perfectly fine, it's okay. Even we take once in a while. But if the child is constantly suffering from cold, cough, say, and runny nose, itchy eyes, or pain in the ear, and the allergies are continuing long, then we have to have a holistic approach where we can give them homeopathy medicines for for a few months, help them each while when they fall sick, so that they come out of the problem fully. They are not dependent upon any inhalers or antibiotics or any steroidal nasal sprays and all. So we help them completely come out of the problem. Yeah.
Okay. So डॉक्टर कलानी जी, आपने कहा कि बचपन से ही अगर आप उसे ट्रीट कर लेते हैं, then आप उसे अच्छी तरह से क्योर कर पाएंगे.
Yes. So childhood allergies are completely treatable, so we can avoid them getting into a bronchitic variety or asthmatic variety if the children, the parents have a history. So if treated under the right age group, so the immunity is perfectly moldable, we can definitely help them, so that they don't suffer in the adulthood phase.
ओके, अगर इसे टाइम से टेस्ट नहीं कराया जाए तो व्हाट आर द कॉन्सिक्वेंसेस, एंड व्हाट इज टॉन्सिलिटिस एंड ब्रोंकाइटिस, एलर्जी, राइनाइटिस? कैन यू हेल्प अस टू अंडरस्टैंड बिटवीन दीज ऑल?
Yes. So क्या होता है, usually when the child suffers, so the first thing is we usually take them to allopathic doctor, because they come to homeopathy only when they are not happy with allopathy. So what happens, you give them some medicines and then they are okay for a while, but then again they fall sick. So when there is a repeated infection or a repeated allergy, then we need to know that we have to treat the allergy and not the infection. The infection is a resultant because the allergy has not been treated well, right? So if the allergies are not treated well, then they usually come up with chronic variety, like they have allergic rhinitis. So we need to differentiate what is the difference between a cold, what is allergic rhinitis, what is adenoids, what is tonsillitis, and what is the upper respiratory tract infection. So we have bronchitis in it. Then we also have asthma related complaints. Then we have to figure out whether they have a nasal septal deviation or something to do with it, turbinate swelling in the nose. So these turbinates are basically, they are the protective mechanism. There is hair and turbinates in the nose cavity, so they stop the allergen or the organism. They try to trap it, so they get enlarged in bargain. So that is where the turbinate swelling and nasal blockage happens. So if we understand what is, say, a common cold will usually subside in a 7-day period, so that's not something to worry about. So you generally have a symptom of, say, body ache, lethargy, runny nose, and then you are done with. You take treatment and you're fine. But if you have runny eyes, if you have itching in the eyes, if you have itching in the ears or itching in the throat, or you have a severe say a heavy head constantly, and your cold goes on for more than 2 weeks time, then we can term it that yes, you have an allergic rhinitis problem, right? Now, what is adenoids and tonsils? So basically these are the lymphoid tissues. So they belong to the lymphatic system, मतलब जो body को protect करते हैं और fight करते हैं so as to avoid the invasion. So what are adenoids? So adenoids are basically small, they are the glands which are present at the nasopharynx. So naak ke piche there are glands which are called as adenoids, and at the beginning of the pharynx. So at the base, say at the nasopharynx, these the adenoids are present. So whenever the child comes up with chronic allergies, they swell up, and they cause constant nasal blockage. The symptoms of adenoids are nasal blockage, heaviness of the head, mouth bleeding, so and not able to, they don't remain fresh because they are constantly sniffing and all. So their efficiency in work also decreases at school. They are constantly, you feel as if they so rahe hain and they're not feeling up to the mark. So these are the symptoms of adenoids. Then what is tonsillitis? If we briefly describe, these are the glands which are present in the throat, on the either side of the throat. Again, even this is a lymphoid tissue. So what happens, like because of the mouth breathing constant, they are under pressure. So in case they come across a child who's having chronic infections, or the environmental causes are there, these tonsils, they will try and trap, or try and protect the lower respiratory, the upper respiratory tract, and try to limit the problem there itself in the throat. And in that bargain, they become red and swollen up. So the symptoms are basically pain in the throat, pain while swallowing. They may get high-grade fever, and sometimes they swell up so badly that they stick to each other. So they are called as kissing tonsils. So you can see when you put the torch in the patient's mouth and you tell them to make a noise, you can actually see the tonsils, which are very small in size. They have बड़े हो गए हैं and they are almost meeting each other, so that we call as a kissing tonsil. And there are also pus points over it, so there is suppuration, so that is infection. So whenever allergies are untreated, it leads to a bacterial infection. So and then the fever is there. So these are the things which if allergy is untreated, then it can lead to, as I said, rhinitis problem, it can lead to adenoids, it can lead to tonsillitis, and next is bronchitis. So what is bronchitis? It's basically after the tonsils, then there is the bronchi which are present in the chest. So the lining of the bronchus, जो tubes रहते हैं, which end into the 2 lungs, right and left lung, उसमें inflammation होना शुरू हो जाता है उसके lining में. So it is called as the bronchitis, that is inflammation of the inner lining of the bronchus. उसकी वजह से there are thick secretions and the patient is constantly coughing and is suffocated. You can also have body ache and chest pain. So you must have heard people coughing very loudly. बहुत जोर से खांसी आती है, जैसे barking cough, and there's a lot of expectoration inside, तो throw out करते हैं बार-बार. That is called as bronchitis. And later it's also we can also include asthma. Now अगर family में किसी को asthma problem है and the child has been complaining of runny nose and all these trouble, if we do not treat it, finally it can also lead to asthma depending upon their susceptibility. सो अगर फैमिली में है तो उनके चांसेस ज़्यादा होते हैं. सो अस्थमा वी हैव सीन टू बी इन द पेरेंट्स एंड इन द चिल्ड्रन ऑल्सो. सो अस्थमा में क्या होता है, देयर इज लाइक अ ड्राई कॉफ, and it does not does not respond to treatment that easily, and there is a constant labored breathing. जैसे सांस लेने में उनको एफर्ट डालना पड़ रहा है. तो वो कॉन्स्टेंट एफर्ट की वजह से यहाँ नेक एरिया में उनको जैसे ना ऐसे कैविटी टाइप हो जाती है, ऐसा डिप्रेशन इन द नेक. यू कैन एक्चुअली सी ही इज गैस्पिंग, ही इज वांटिंग टू टेक मोर एंड मोर एयर बट नॉट एबल टू टेक. And the same condition in the ribs also you will find. So lot of it depends upon the presentation. So clinical knowledge is also very important to differentiate whether it's bronchitis, it is asthma, So these are the things. If the allergies are left untreated, it can go to a variety of things like this. And asthma में एक और चीज बोली जाती है, like because of the low oxygen content you will find blue nails or you will find blue lips. So these are, if asthma is a little difficult to treat, but if allergies are treated in time, asthma can also be controlled and can be dealt with very easily. So homeopathy definitely helps in treating allergies because we work upon the immunity and not the trigger. The triggers could be bacteria, but they attack only when the immunity is low. So these are the things which I would I wanted to tell this, because if the allergies should be always be treated in time and with the right approach, with the right therapeutics.
ओके डॉक्टर कलानी जी, मतलब आपका कहना ये कि एलर्जी से हमारे इतने सारे बॉडी ऑर्गन्स अफेक्ट होते हैं.
Yes.
और उन्हें हमें प्रॉपर्ली ट्रीट करना चाहिए.
Yeah, and these are the things which may happen depending upon the weakness of the organ. All will not fall sick with adenoids. किसी को adenoids होंगे, किसी को depending उनका travel ज़्यादा है या खाने की ठंडा खाते हैं तो tonsils affect हो जाएंगे. So depending upon how much care you are taking of yourself and your genetic inheritance and the type of treatment you are taking, so that determines the extent of the illness.
जैसे किड्स में हम लोगों ने हमेशा ब्रोंकाइटिस देखा ही है.
Yes.
And usually by the time when you treat them, वो चीजें चली भी जाती हैं.
Correct. So treated in time, bronchitis is also fully treatable. We can work upon it. ऐसा नहीं है कि it's like not treatable.
Homeopathy is good, yeah.
Basically chronic variety. So if your cough and cold or your pain in the throat, your sinuses are getting filled up very often, if you are not getting solution with the regular treatment, then you have to definitely opt for. You are not left with any choice. We have to help the patient come out of it.
Yes.
So and homeopathy definitely works great in relieving the draining of the sinusitis rather than getting into any surgical intervention for drainage. It's very painful. Plus it happens again and again. The problem is the recurrence. Always remember.
Correct.
So we have to work upon the recurring element. So homeopathy works upon it very well.
Dr. Kalani ji, we have heard that chronic skin problems like atopic dermatitis, psoriasis, ये सब कोल्ड एलर्जी से लिंक्ड होते हैं.
Yes, अभी ये बहुत ज़रूरी है क्योंकि कॉमन मैन और लेमैन को ये काफ़ी समय पता नहीं रहता है कि whenever they see that ये जब ये अटोपिक डर्मेटाइटिस बच्चों में रहता है, जैसे इचिंग होती है, folds, the bends of the elbows or the back of the knees. So these are the points where it actually starts showing first. वहाँ पे इचिंग भी होना शुरू हो जाती है, which we call as atopic dermatitis. So both we need to clarify very nicely and convey to the patient that skin and the chest complaints are always interlinked. Why? Because both are breathing organs. So as we have evoluted, the lungs have become the primary breathing organ. So but skin is also a very important thing. But in human beings, it's the lungs which have to be has to be treated first. So always priority to the lungs. First treat the cold allergies and then treat the skin allergies. Right? So once the cold allergies are fine, you will find that the skin allergies are also improving and we need very little time for the closure of the skin allergies. But if you do it, the other way, if you try and treat the skin first, then what happens, the allergies of the lungs can go very bad, which we don't want, because lungs are the first and the prime thing that we have to safeguard. right? So always remember that many times in lot of chronic cases you will find people coming up with atopic dermatitis, psoriatic patches, eczema, dermatitis, and this happens when their cold allergies have not been treated properly. And you have now a confusion. Ab kya kare? Both are at its peak. So this is what we have to convey, that if you find that you are having skin allergies as well as cold allergies, kindly please take care of the lungs first and then the skin. If you have received a good treatment for lungs and your immunity is better, then we approach the skin and automatically over a period of time skin also responds better, right? So many times people say, but what do I do? I am having both. But we have to convey and convince the patient the way I am telling. First, let's treat the lungs. We'll give you something soothing so that we don't want to suppress the skin problem, because it will drive it in and get to the lungs. So first the lungs and then the skin. So this is how we always explain it to the patient, and patients also understand, okay, maybe this is how it should be. So we have to make the people aware about the alternating symptoms.
Sometimes it must be difficult to let them understand this, because skin is the thing which everyone is watching, I guess, right? Because this is the information even I didn't knew about.
Yeah. So basically, because of the cosmetic value of the skin, everybody wants that आप पहले इसको करो, ये तो ठीक है, ये होता रहेगा. But then we have to explain them, and then this is how the course is, and you have to go by that.
Right. If lungs are okay, then skin will be fine soon.
Yes. The lung capacity, the functioning is also very, very important.
Of course. So Dr. Kalani ji, how to prevent allergies? This is the main thing.
Correct. So see, basically prevention is always good. So if you are able to avoid the flare-ups, that means the repeated problem, then your problem will not get chronic. So it is also a person's duty to not allow themselves to get exposed to, because once in a while what happens that children take up something from the fridge, something, a cold drink or an ice cream, and the parents are also not aware, or they feel emotionally bound, kab tak rokenge, khane do. But what happens if your immunity is low? You are inviting infections again and again. So by inviting infections, you are making the problem very chronic. So preventions में ये सब आता है, as I said, कि dust mites. So always clean up your house. So dusting, cleaning of the beds and the carpets and everything. Secondly, keep the condition of your walls. Then other thing is pigeon droppings, so which we find in Mumbai a lot. So you have these droppings which are very allergic, and the person is constantly sneezing because of it. And third is the fungus on the walls, the spores which are there in the air, because of which the child, there's no chance. It's like sleeping under the damp wall. Your cold is not going to get better anyway. You do anything, we are just firefighting each while. So these preventions are also very important. Then people are not aware, say sinus जैसे fill up हो जाता है बार-बार. So you need to be very careful, so you not to wash your hair, and in a dry wet hair you should not move out in open rickshaw or a two-wheeler. You constantly, that blast which is there on your head, the sinus spaces will get filled up. So meaning, how do we deal with that? So if the trigger factors are very strong, then the treatment course also becomes difficult for us to keep giving medicines. So prevention has to be maintained. That's very important. So we have covered the dust mites, we have covered the damp walls, so then also the eating habits, the cold intake, then traveling. Then also one thing important is that you have to develop your lung capacity. So if you have an optimum immunity level, after a while we have treated, we usually say that now it's the time for you to, you can exercise well, say do running exercises and all, but that optimum level of immunity should be there so that you don't catch infections, say in open air again. So that is also very important. So you can also have physical exercises, pranayam and all, which can always help increase the lung immunity. So these are the things which always help in prevention. And prevention is always better than any type of treatment and cure, because it helps us in treating more easily. So less flare-ups, the less chronicity. More flare-ups, more the problem and more the medicines. Be it allopathy, homeopathy. So prevention is always better.
Yes, so दोस्तों आपको अपने ट्रिगर्स पे भी ध्यान रखना होगा. अगर आप उससे दूर रहेंगे तो काफी हद तक आप ठीक रहेंगे. और डॉक्टर कलानी जी, what is the role of homeopathy and how it helps?
Yes. So basically when we see the child, when they usually come up with an allopathic file and we go through it and we find a lot of investigations done and a lot of prescriptions showing up, inhalers and antibiotics. So we come to know that the patient's immunity is very low and so is not responding to treatment because of the chronicity. So here we need to understand, we take a complete case history to know where is the problem. So hereditary history bhi li jati hai. Then we have the desires, aversions, likings on the physical as well as the emotional level. आपको खाने में क्या पसंद है, आपका sweating कहाँ होता है. So we conclude the constitution. हर एक का एक constitutional medicine होता है which is called as an immunity booster medicine. And that is the backbone of the treatment. And we have different constitutions. So we have to take a little detailed case history to understand the person's nature also and his physical tendencies, weaknesses as well as the genetic influence. So एक totality के ऊपर एक constitutional treatment इसमें बाहर आती है जो जब हम treat करने लगते हैं तो that is the main thing which helps the system to prevent the repeated relapses. So once we start giving that, the body learns to to make his or her own antibodies, and we don't have to provide passive immunity in the form of antibodies, antibiotics each while to fight the infection. So they learn how to fight off the infections by themselves. So the constitutional medicine is the most important thing in homeopathy, and of course some amount of symptomatic relief for nasal blockage and other symptoms is always available. So that is how we modulate the system with the help of our diluted medicines, which they work on that plane and they improve the immunity so as to understand what is the weakness, the vacuum, the susceptibility of the patient. Once that vacuum is fulfilled, we find that the problem is getting better, the recurrence is better, and they are responding well to any treatment, be it homeopathy, even allopathy starts working upon them well. Why? Because we have dealt with the immunity, the vacuum has been filled up, the susceptibility problem has been dealt with. So this is how homeopathy helps in treating the chronic problems.
Thank you so much doctor for sharing your knowledge on homeopathy, and I hope कि हमारे listeners को आज का एपिसोड पसंद आया होगा और होम्योपैथी के बारे में और भी जानने का मौका मिला होगा. I request all my listeners कि वो होम्योपैथी के बारे में सारी इन्फॉर्मेशन अपने फ्रेंड से, फैमिली से, क्लोज रिलेटिव से शेयर करें और सुनते रहें टच लाइफ फाउंडेशन का टैल रेडियो. थैंक यू सो मच फॉर लिसनिंग. मैम, बिफोर दैट प्लीज जस्ट शेयर योर नंबर सो दैट मेरे लिसनर्स अगर आपसे कांटेक्ट करना चाहते हैं तो वो कर सकें.
Yes, I basically practice in Mumbai at Powai, Kiranandani, and I've been practicing since last 24 years. We are there present, physical, with consultations as well as online is also pretty okay now. So we have our phone number. I can share it with you. The number is 82914 92566. So always feel free to, we are always there for help in case of chronic allergies in children, adults or, old age. The results are very good. So always opt for homeopathy in chronicity.
Thank you so much Dr. Kalani ji for giving us time from Touch a Life Foundation Style Radio. We are very thankful to you.
Thank you so much.